All right. Hey, everyone. We are here on day 2 of the 7-day summit of health and wellness in the Black community. Today, I have such a great pleasure of introducing you to Dr. Hagans, who is going to share with us what she's noticed in her patients, chronic illnesses such as high blood pressure and diabetes. So she's going to share her practice, a little bit about her, and what she's definitely noticed more of these chronic diseases that she's noticed in her African American patients, and we'll share some tips and suggestions on either how to um, control that disease or kind of keep it at bay. So, Dr. Hagans, thank you so much for joining us.
Thank you. Thank you for having me. Glad to be
Yeah,
here.
absolutely. So, where is your practice located?
We're in Southeast Washington, D.C. We're in a neighborhood called Anacostia. So we're inside of a church, actually, the church that I grew up in. So that's been interesting and fun building that practice.
Absolutely. So I would love to know if you could just share just a little bit about, you and your practice as well.
So it's a general family medicine practice. So we do your traditional family medicine, sick visits, sports physicals, got a cold, I have a rash, those kind of things. But then we also like to talk to people about what they're eating, what they're drinking, what they can cut back on, and how that contributes to their health.
Absolutely wonderful. And that leads us to, the conversation of high blood pressure and diabetes. Talk to us a little bit about, what you've noticed as this, chronic illness in your patients, and, give us some tips on what we can do about lowering the blood pressure or keeping that A1C number down.
So main thing is to get your blood pressure checked in the first place to find out what it is. You aren't necessarily going to feel anything if your blood pressure is high. If you're starting to feel something, dizziness, headaches, chest pain, blurry vision, it's probably where the horse is probably out of the barn. Your blood pressure is probably super high. But when you're getting into those pre-hypertension and you're just over the edge, like maybe it's around 130 over 90 or 140, you probably aren't going to feel anything. So you need to get your blood pressure checked regularly. If you don't have a history of high blood pressure, you need to at least have a yearly physical. And then if you do have high blood pressure, it depends on how well it's controlled, whether you see your doctor every 3 months or every 6 months. So that's the first thing, to find out what your number is. And really, 120 over 80 is considered a perfect blood pressure. But if you're in between the 120 and the 130, the top number, then you're considered pre-hypertension. If you're getting close to that 130, that's pre-hypertension. And then the 130 over 90, if you meet the criteria for having high blood pressure. So really want to get on top of that. Now that changes if you're older. Like if you're over 65, we don't necessarily want your blood pressure to be 120 over 80 because it probably make you feel dizzy and weird. So for older people who are on high blood pressure, we just need to try to get them less than 140 over 90. We don't try to get them super low. So it kind of depends on what kind of medical problems you have and how old you are, like what your goal is.
Right.
Yeah. But for the most part, most people need to be less than 130 over 90.
And what are some ways that you could suggest as far as not getting to that 130 over 90 number?
Okay, so salt is a big thing, and I love the taste of salt. So we really have to be careful what kind of things that we're eating, and try to make sure that you're making most of your food yourself, because really processed foods tend to have a lot of salt in them. Frozen dinners, fast foods, whatever. If you're buying it in a box or a bag, it probably has salt in it, even if it doesn't taste salty. Like you could get a can of green beans and it doesn't taste like salt, but look at the sodium content and it's a little too much for somebody with high blood pressure. You look at the back of like a frozen pot pie, maybe it doesn't taste salty, but it has like 1,100 milligrams of sodium in it. Like, oh, I can't eat that. I put that right back before I have a stroke. So in general, my general rule for myself, I think that if I'm gonna buy something that's pre-made, I try not to, but if I have to buy something that's pre-made, I look at the back of it and see what the sodium is per serving. If it's more than 400 milligrams, that's too much. Let me just put it back.
Okay. Oh, I love that when you said if it's in a box or a bag, it probably has a lot of sodium. I love it.
Yeah.
I love it.
You really want to try to shop the outside of the grocery store. All the processed stuff is usually in the center, and then the produce, the fresh fruits, vegetables, meats, bulk stuff like seeds and nuts are usually on the outer part of the grocery store. So that's where you want to be getting most of your stuff from.
Excellent, excellent. And so we talked about high blood pressure and we looked at the numbers 130, 90. We looked at, salt being a main contributor to increasing the high blood pressure. And you shared with us, it's in a box or a bag, you might want to put it back. let's let's look at diabetes. Talk to me about that, because I know previously we talked about one of what you see is from your patients is, high blood pressure and diabetes are the two chronic illnesses that you encounter with your patients. Talk to us a little bit about, diabetes, what you've noticed. What are some of the things, if you have diabetes, what are some of the things that could, quote unquote, go wrong with your health, and how can one avoid getting diabetes or at least keep it under control?
Okay. So some of the things that can go wrong with your health are usually related to diabetes attacking your nerves or your blood vessels. So anything in your body that has a nerve or a blood vessel, diabetes can attack it. So uncontrolled diabetes can affect your heart. It can affect your eyes. It can affect your kidneys. It can affect the nerves that go to your hands and feet, where you get numbness, tingling, or lose your feeling and get amputations, God forbid. But this is the reason. Too much sugar is kind of like having syrup in your blood, and it's scratching up and damaging all those blood vessels and tiny nerves that go to the organs inside of your body. So the first thing is to find out what your numbers are, because there's like 18 million people in the United States who probably have pre-diabetes, and a lot of those people don't know about it. They have no idea what their blood sugar is. So that's one thing, to find out what your blood sugar is. And basically the cutoff for diabetes, if you haven't had anything to eat or drink except for water and you have a fasting blood test, blood sugar should be less than 126. If it's 126 or more, then you have diabetes. A lot of patients say that. You ask them about their medical history, like, do you have diabetes? Well, that's what they said. No, that's what your number said. It's a concrete thing. It's not a guess. Like, it's 126 or more, that's it. Or even if you're not fasting, any random blood sugar that's more than 200, then you have diabetes. Like, I also work in an urgent care, and if you got a random blood sugar and you're not fasting, it's more than 200. Like, you didn't have diabetes the other day, but you have it now. Surprise!
Wow.
Let's do something about it. So what do we do about it? Really want to try to limit the things that have sugar in them and the things that can turn into sugar. So not just plain sugar, but starches and stuff that turn into sugar. So I tell people to try to limit white rice, white potatoes, white pasta, white bread. And then they say,
Anything
well,
white.
you don't want me to eat anything. That's not true. You can substitute these things. So for example, like, instead of white pasta, you can get wheat pasta. You can get something that's called a spaghetti squash. You may have seen it in the store and didn't know what it was. It kind of looks like a melon, like a little round yellow melon. But if you split it open and scrape the seeds out, it kind of looks like a pumpkin inside. And you can season it the way you would season your pasta, with olive oil, a little salt and pepper, garlic powder, whatever, and bake it at like 400 degrees until it starts getting soft. Probably takes about 30 minutes, depending on how long your oven's been preheating. And then take your fork and scrape it out, and the noodles come out. Well, it's not noodles, but it's squash, but it comes out like a noodle, and you can use that in place of spaghetti noodles. And then sweet potatoes actually have less effect on your blood sugar than white potatoes. Granted, if you're not covering them with sugar and syrup.
And
I'm talking about candied yams. I'm talking about like a baked sweet potato. Yeah, so those are some of the changes that you want to make. And then soda is like the hugest culprit. Now, I like to have a ginger ale or a Sprite or something every now and then if I go to a restaurant. But I'm talking about like daily sodas. If you're diabetic, your body cannot do that. As a matter of fact, your body probably can't handle a regular soda. Like every now and then, you could have a diet soda, like as a treat. But I don't even like to see my diabetics drinking diet sodas every day, because what that's gonna do is kind of confuse your brain about what to do when it tastes sugar. So let's say that you're drinking diet sodas all the time. Your body tastes something sweet, but then it doesn't get a sugar load with it. So then it gets confused. It's like, oh, well, I'm not gonna put out any insulin because I don't see any sugar. So then you go to eat other stuff and your brain's confused and it's like, well, it tastes sweet, tastes like the diet soda, but I didn't get any sugar, so I'm not gonna put out any insulin. So then you start developing insulin resistance. They've done studies that shows that drinking diet drinks or whatever for long periods of time kind of increases your body's confusion or resistance to its own insulin. So diet sodas are not a great alternative either. Yeah. So if you're diabetic, really what you should be drinking mostly is water. I'm not saying you can never have anything else, but if you're gonna have something sweet, like let's say it's a natural juice, make sure that if you're not making the juice, make sure that you're looking at the back of the label. It might say there's no sugar added on the front, but then it might have some sneaky ingredients with other names for sugar in the ingredient label. So you want to look at the back of that and make sure it just says water and whatever the fruit is.
Right.
And then you can safely have that. And that's still going to have some sugar in it. It's going to have fruit sugar in it, fructose. But you could have a little tiny, I'm not talking about filling up a glass, I'm talking about a juice glass, the little 4-ounce thing. And you could have that with a meal, and then your body kind of knows what to do with it and can take care of the sugar from that as it takes care of your meal. You may can have that every once in a while if you needed something sweet, but really mostly what you should be drinking is water. And then you can drink tea, but not sweet tea, of course. You can really train your mouth to get used to having less sugar. Because I started doing that one day, because I like to put honey in my tea, but then I kind of got tired of like carrying a honey bottle back and forth to work. So I kind of trained my mouth to like tea without anything in it. And you can really get used to the taste of it, especially if it's like a flavored tea. Like let's say it's like I don't know, like a peach tea. It doesn't have any sugar in it, but it has like something else to kind of give it flavor, like a lemon, or you can put lemon, actual lemon juice in it, or soak your fruits in it to kind of give it a flavor, blueberries, strawberries, whatever, to kind of get away from having actual sugar and get your tongue used to the taste of natural sugars. I talk a lot, but
no, that's fine,
but
that's what we need. I mean, I tell you what I have learned today is the 3 big S's: salt, sugar, and sodas. No, ma'am. No, ma'am. And starch. So salt, starch, sugar, and sodas. No, ma'am, you cannot have them.
You can have them sometimes.
Sometimes, but let's not make it on a regular, you know.
Yeah.
Well, Dr. Hagans, I truly, truly appreciate you joining us today and just sharing with us, you know, what you've noticed as far as chronic illnesses and ways that we can actually go about, you know, kind of living with it, or either not even getting to that point. So I thank you so much. The information for her practice is in the link, and there will be more. Thank you guys so much.